everyone, my name is Dr. Rahul Deshpande. I'm a practicing orthopedic surgeon at Urmi Orthocare Center, Srinagar, Wagli Street, Thane. Today I will be speaking on a very important topic that affects many of us at some point of our lives, that is the bone fractures. Whether it is a result of an accident, sports injuries, or other circumstances, fractures can be painful and may require proper care to ensure optimal healing. So today I'll share with you some crucial do's and don'ts which are required during bone fractures. So let's start with the do's. First of all, if you experience a fracture, then it with or suspect intense pain, immediately call for emergency assistance or visit the nearest hospital. It is most important to immobilize the affected part. If possible, try to immobilize the fractured bone or joint to prevent further damage. Use splints or even makeshift immobilization available materials and wait until you receive medical help. Apply cold packs that will help in reducing pain, swelling, and inflammation at the affected site. Wrap the ice pack in a cloth or a plastic bag and apply it to the affected area for 15 to 20 minutes or for a few hours until help arrives. Follow the instructions given by your doctor. Then, what is the plan? The doctor will recommend the appropriate treatment, may involve immobilization, that is, plaster application, or physical therapy, or sometimes even surgery, which is most important in certain unstable fractures which need to be fixed. And wait until you get that medical advice and do according to the doctor's prescription. It is crucial to adhere to this prescribed therapy for optimal healing. Now, what are the don'ts? Most importantly, avoid putting weight on your foot or affected part, especially if there are foot fractures. It is better that if suppose there is a finger fracture in the foot, then it's better to walk on the heel so that you don't apply pressure on the fracture. And then if the fracture is unstable, it might dissociate from the fracture site and that may require surgery. So you can avoid surgery by just not putting on weight. Then if there is, you have to prevent damage to the affected part by not bearing weight on it. Many times there are people who are besides you. They may advise you realignment of the bone. Suppose there's some shoulder dislocation or there's a fracture of the elbow or the wrist. Then people try to attempt realignment of the bone, thinking that they are bone setters. But I would advise you to go against that because that may damage the area or the surrounding structures which are in the fracture site. Because if suppose there is a nerve or a blood vessel which is entangled in between the fracture fragments, then that may cause injury to that during the realignment process. So let the doctors decide what is the best treatment for the patient. Do not ignore signs of infection. Suppose you feel that there is some kind of fever or redness, or there's some kind of discharge from your wound which you have sustained, then it is better to immediately consult your doctor because then he will prescribe some certain antibiotics, because that may be a sign of infection. And if the infection is superficial, it can be taken care of. If suppose it goes to the bone, then it becomes difficult to manage. And don't rush to healing process. That is, recovery process. Healing of fracture takes a long time. It takes at least 3 to 6 weeks for basic fractures which are not displaced from their position to heal. So don't be in a hurry for the recovery process, because if the doctor has advised you plaster for 6 weeks, then better to continue the plaster, because if you give it for more time, then the healing process is better and calcification is better, then the bone strength will be better. Otherwise, there will be refractures if you remove the plaster early. So these are the things which you need to follow. Follow the doctor's advice and do not try to be self-prescribed doctors, and don't be Google doctors, because that will hurt you in the process. Okay, thank you so much.